While traveling across the state earlier this month, Senator Tim Johnson and I held a series of health care hearings, including events in Sioux Falls, Yankton, and Mitchell. We heard from a variety of South Dakotans about the challenges they face in navigating our country's system of care. From the parent of a child with heart and lung problems whose insurance company initially denied coverage because it deemed the child to have had pre-existing conditions, to the small business owner who's at risk of losing valuable employees because he may not be able to afford increasing premiums. To be sure, families and businesses across South Dakota have a range of reasons for wanting to improve health care. One thing most agree on is that the current system is broken and unsustainable. The skyrocketing cost of health care under the status quo is not only bankrupting families and businesses, it's leading this country down a path to fiscal disaster. If we ever hope to restore responsibility to government and protect our economy for future generations, we have to get health care costs under control. Put another way, we can't afford not to reform health care. We all have different but important reasons for wanting health care reform. We have friends, family, and neighbors who faced health care crises with limited or no insurance coverage, resulting in emotional, physical, and financial hardship. We all know someone who's rolling the dice without any coverage at all, just one accident or one health care emergency away from devastating consequences. We're concerned that our parents, who've spent a lifetime paying into Medicare, will enter an unfair system that threatens the quality of care they're entitled to receive. We know small business owners who are struggling or unable to continue to offer insurance because of increased rates. We're worried that our children will inherit the massive debt created by this broken system we're unable or unwilling to fix. Progress will be difficult, but getting it right is more important than getting it done right away. I'm concerned that current proposals don't do enough to focus more on squeezing out every dollar of savings from the current system before simply adding additional consumers onto the existing broken framework. I'm committed to working with my colleagues on both sides of the aisle and the President to pass comprehensive, deficit-neutral health care reform. But we need to take time to address these concerns. It's simply too important to rush. The time for reform is long overdue, and I'm committed to improving the health care system on behalf of South Dakota's families, businesses, and providers. They deserve a health care system that's more available, more accessible, and more affordable.